after we complete the information about estrogen, and now we will speak about progesterone and progestogenes. Actions of progesterone are progesterone and progestogenes have a secretory effect on endometrium and also anabolic effect and increase bone mineral density, also lead to fluid retention and mood changes. The side effects are weight gain due to fluid retention, acne because they have some androgenic effect, also lead to nausea and vomiting, irritability, depression and premenstrual syndrome. Premenstrual syndrome means the patient has pelvic congestion and pain before the menstrual cycle. Also patient has severe depression and irritability, and these symptoms are released within the start of the menstruation. Also progesterone lead to lack of concentration, and this is more demonstrated in the pregnant women because they have a high concentration of progesterone that's secreted from the placenta. So these are progesterone and their derivatives, which including natural progesterone is progesterone and 17-alpha hydroxyprogesterone caproate, while the synthetic progesterogens are medroxyprogesterone acetate and migestrol acetate, also chlormadione acetate. Clinical uses of progestins are contraception in the form of pills, intrauterine device, implant and depot injection, or used for prevention and in treatment of endometrial carcinoma. Also used in abnormal uterine bleeding and the treatment of uterine fibroid, adenomyosis and endometriosis. The adenomyosis mean presence of the endometrial glands and stroma within the muscles of the uterus, while the endometriosis mean presence of the endometrial glands and stroma outside the endometrial cavity anywhere in the body, like in the pelvis and others. Adenomyosis and endometriosis lead to abnormal uterine bleeding, pelvic pain, dysmenorrhea, dyspareunia, and infertility. Also, progestogenes used in progestin challenge test, which is used in patients with amenorrhea, as the occurrence of withdrawal bleeding exclude anatomical defect in genital tract like imperforated hymen or complete transverse vaginal symptom in cases of primary amenorrhea, or it exclude a Sherman syndrome, which means adhesion of the uterine walls in cases of secondary amenorrhea, while absence of bleeding indicate chronic anovulation with absence of estrogen. Progestogenes also used as a part in hormone replacement therapy to oppose the action of estrogen on endometrium to reduce risk of endometrial hyperplasia and carcinoma. Antiprogestogenes are mifepristone, which has partial agonist activity to progesterone receptor and inhibits progesterone action. Also, it is cause sensitization of the uterus to the prostaglandins and used for medical termination of pregnancy and induction of labor. This is our chemical structures of mifepristone, and this is example of a drug available for the treatment. Other type of antiprogesterone is selective progesterone receptor modulators, including elebristal acetate, azopristine, and tilabristone. Elebristal acetate has partial agonistic as well as antagonistic effect on the progesterone receptor. It also binds to the androgen and the glucocorticoid receptors, but it has a weak anti-androgen and anti-glucocorticoid action. Therefore, it is not used in the patient with asthma using glucocorticoid treatment. The mechanism of action of elebristal acetate is by blocking or delaying ovulation and of delaying the maturation of the endometrium. Therefore, it is used for emergency contraception to prevent pregnancy and used in treatment of uterine fibroids. This example of elebristal acetate available in a brand name Elawan, which is a one tablet contain 30 milligram. Another type of levosyl acetate treatment available is as a capsule. Each capsule contains 5 mg. Now we speak about testosterone and methyltestosterone. The mechanism of action of testosterone are as agonists at androgen receptors. Testosterone has anabolic effect on development of the secondary sexual characteristic, therefore used in the treatment of hypogonadism and promote development of secondary sexual characteristic and stimulate anabolism to promote recovery after burn or injury. These are testosterone and 19 norandrosten derivatives. The routes of administration of testosterone are by implant like testosterone or intramuscular injection for enantiate or propionate, or oral administration for indicanoate or mistrinolone. The side effect of testosterone: acne, musculization in females, reduce intratesticular testosterone in male by inhibition of luteinizing hormone via negative feedback, and this will lead to the gonadal atrophy and infertility. Also, testosterone leads to the premature closure of epiphyseal plates, and it will lead to change lipid profile and leading to the increased low density lipoprotein and decreasing high density lipoprotein. The anti-androgens are finasteride, which is 5-alpha reductase inhibitor. It decreases conversion of testosterone to dihydrotestosterone. As you see in this picture, the testosterone converted by 5-alpha reductase to more potent testosterone, which is dihydrotestosterone. And this potent testosterone acts on the skin and lead to the development of secondary sexual characteristic and hair growth. And this example of finasteride is a tablet contains 5 mg. It is used for treatment of benign prostatic hyperplasia and male pattern baldness. And so this is another type of finasteride. Flutamide is another drug that antagonizes androgen action, and it is a non-steroidal competitive inhibitor at androgen receptors, and it is used for prostatic carcinoma. This example of flutamide tablet. Each tablet contains 250 mg. Another type of anti-androgens is cyproterone, which is progesterone derivatives. It has weak progestogenic effect and has partial agonist to the progesterone receptor and compete with dihydrotestosterone. It is used in combined contraceptive pills called Dinate, and it's used for the treatment of severe acne and hirsutism. Now we speak about transport of steroids, mean transport of estrogen, progesterone, and androgen. The transport of this hormone occur by binding to the sex hormone binding globulin, with exception of progesterone, and little amount to the albumin. Then they are metabolized in the liver. Progesterone almost totally metabolized in one passage through the liver, while estrogen take 2 passages. The metabolites of these hormones are excreted in the urine as glucuronides and sulfates.